In 2014, the percentage of Americans that were obese was 27.7%, according to an article by News Text and Finance and Accounting blogs. This means that Americans are consuming enough calories to be harmful to their bodies and even deadly. In our fast-paced society, fast food has become an essential part of our everyday lives. Although this fast food may seem convenient at the time, the food you are consuming will harm your body and cause major weight gain over time. Over the past several weeks, I have researched the effects of obesity on the body and the benefits that can come from choosing healthier food options. People tend to reach for unhealthy foods at the grocery store or go through a drive-thru because it is cheaper and easier than some other healthier food options. What if the government placed a tax on fast foods and foods with high amounts of sugar? Would Americans still gravitate towards the fattier food options? The government should put a tax on unhealthy foods that are killing Americans to decrease obesity rates and heart disease in America. By taxing the food that is causing heart disease, obesity, and diabetes, we could increase the economy and the health of our nation. Did you know that the annual cost of health care of heart disease patients in the U.S. is $444 billion? Cardiovascular disease is the #1 cause of death in our nation. This information comes from an article written by Harris Meyer called Taking Aim at America's #1 Killer, One Key Disease Factor at a Time. Consuming foods that are high in sodium and fat can put you at risk for heart disease. If there was a substantial tax placed on these foods, people would most likely avoid buying them. By not purchasing unhealthy food options, Americans would eat more vegetables and natural foods because of the lower price. The tax would increase the sales of health-conscious foods and decrease the amount of heart disease in America. If the government began placing a tax on some unhealthy food options, the government could save a substantial amount of money on the heart disease patients that need health care every single day. Taking sugar-filled foods and fast foods, or taxing sugar-filled foods and fast foods, would put pressure on families to buy healthier food options. There have been sugar taxes placed on sugar and soft drinks in other countries that have been proven to be successful in decreasing the sale of unhealthy food and drink options. According to the American Journal of Public Health, there have been sugar taxes placed on food and drink in Britain, Mexico, and Denmark. This article also states that there is evidence that the taxes have been successful. The American Journal of Public Health states that in Mexico, there have been fewer purchases of sugar-sweetened beverages in the lower-income families. This article, Taxing Junk Food to Counter Obesity, found in the American Journal of Public Health, mentions that Denmark was the first country to place a fat tax. The purpose of the tax was to reduce the amount of cardiovascular disease in Denmark, which was an epidemic along with our country. According to the American Journal of Public Health, any food containing more than 2.3% of saturated fat costs an extra 16 kron, which is an American $3 per kilogram, which is 2.2 pounds. Placing a tax on certain foods may seem like it is taking away our personal freedom, but people in America are making such bad choices for their personal health and well-being. These bad choices are hurting our economy and overwhelming our federal healthcare system. Obesity, along with cardiovascular disease, has become an epidemic in the United States. It is exhausting our healthcare systems to treat patients who suffer from these diseases. Billions of federal dollars are being spent on healthcare for Americans who suffer from cardiovascular disease. By decreasing the amount of heart disease in the United States, our government can save billions of dollars annually. Decreased productivity is also a side effect that can come from being obese. If people are not working as hard as they could if they were eating healthier food options, then businesses are losing money every single day. The junk food tax would potentially save the government billions of dollars each year on disability for morbidly obese patients who can no longer work. The government is distributing an immense amount of money to assist people who can no longer work because of their obesity-related health problems. As the obesity rate rises in America, federal disability assistance increases. According to an article from Health Affairs titled, "Healthcare Costs Are a Key Driver of Growth in Federal and State Assistance to Working Age People with Disabilities," federal disability spending totaled $375 billion in 2008. This money is going to working age people like us between the ages of 18 and 64, according to Health Affairs. Some of these are working age people who are drawing disability due to their obesity or weight-related health problems. If the government could regulate the sugar intake of Americans, the money spent on healthcare and disability could go towards helping children and families learn better eating habits. In theory, if a large percentage of Americans made better eating and lifestyle choices and no longer needed obesity-related health care, the government could be distributing money brought in by the junk food tax and a decrease in disability demand to programs that help less fortunate and low-income families afford healthier food options. According to an article posted in the U.S. National Library of Medicine called "Is Poverty Associated with Obesity Among American Children?", the obesity rate for low socioeconomic children has continued to increase over the past several years. Although the low socioeconomic children have a higher increasing rate of obesity, the article explains that children that are in the high socioeconomic class have a decreasing obesity rate. I believe that this is a result of higher priced healthy food options. Low-income families choose to buy an abundance of junk food and fattier meats because of the cheaper price. If the sugar and junk food tax was put into place, these low socioeconomic families would be pressured to buy more nutrient-dense foods. This would help manage weight in children and decrease the obesity rates in low socioeconomic children. The money brought in by the junk food tax could assist the families who receive federal help in choosing nutrient-rich foods that would benefit their health. By taxing these foods, we can boost our personal health and take some stress off of our federal healthcare systems. Obesity and cardiovascular disease have become a dangerous epidemic in our nation. The government is dispensing an immense amount of money to citizens who are deathly overweight and have health conditions. Taxing the food that is killing Americans could help turn the health of our country around. Our bodies are precious, and it is vital that we care for our health and well-being. Putting financial pressures on Americans to buy healthier food options would be extremely beneficial to our economy and healthcare systems. I challenge you today to choose nutritious foods that benefit your well-being and make a small step in decreasing American obesity rates. Thank you.